Noticing unexpected fluid leaking from your penis? It could be harmless, or a sign your body's trying to tell you something. In this video, we'll break down what kinds of discharge are normal, what might be a warning sign, and when you should talk to your doctor. Hi, I'm Dr. Zoe Hartley, and this channel is where men over 50 get real, straight answers about their health, especially the things we don't always talk about. Let's take the mystery and fear out of what fluid from your penis might mean. Let's start by identifying the different fluids that might come out of the penis. 1. Pre-ejaculate, pre-cum. Clear slippery fluid. Normal during sexual arousal. Comes from the Cooper's glands, helps lubricate and neutralize urine traces. 2. Ejaculate, semen. Milky white fluid released during orgasm. Contains sperm and seminal fluids. 3. Urine leaks. Small dribbles after you think you've finished urinating. Common in men over 50, often due to a weak urinary sphincter or enlarged prostate. 4. Abnormal discharge. Yellow, green, cloudy, or smelly fluid. Can occur even when you're not aroused. May signal an infection or inflammation. If you're over 50, your body changes in ways that can increase fluid leakage. 1. Enlarged prostate, BPH. Can press on the urethra and cause urine to back up or leak. 2. Weaker pelvic floor muscles. Leads to post-urination dribble. 3. Reduced testosterone. Affects arousal and sensitivity. 4. Residual semen. If ejaculation isn't forceful, some semen may leak later. All common, but worth watching if they change or become uncomfortable. You should always get checked out if you notice. 1. Discharge with pain or odor. 2. Ongoing dribbling or fluid even without stimulation. 3. Changes in the color, consistency, or amount of discharge. 4. Swelling or redness around the tip. 5. New sexual partners or risk of STIs. A simple urine test or swab can often diagnose the issue, and treatment is usually fast and effective. Here's how to support healthy function and reduce unwanted leakage. Heavy checkmark. Fully empty your bladder. Take your time. Heavy checkmark. Practice pelvic floor exercises. Kegels. Heavy checkmark. Stay sexually active. Good for prostate health. Heavy checkmark. Use protection if you're sexually active. Heavy checkmark. Keep regular checkups with your urologist, especially after 50-inch. So if you've noticed fluid leaking from your penis, don't panic. It's often normal, but stay informed and aware. For more men's health answers, watch our next video. Is it okay if my penis is curved when soft? Hit that subscribe button and let's keep this conversation going. No shame, just real talk.